Hi there, and thank you for taking the time to understand the potential risks associated with routine surgeries. While surgery is often necessary to treat or manage a medical condition, it's important to be aware that even routine, simple procedures carry certain risks. And today I'll briefly highlight some of the most common injuries we see in our medical malpractice cases. Number one, nerve damage. One of the most common types of injury during surgery is nerve damage. This can occur when surgical tools inadvertently come into contact with or compress a nerve. For example, during procedures like a hip or knee replacement, nerves in the legs may be injured, potentially leading to numbness, tingling, and even motor loss function. Most cases, that nerve damage is temporary, but in some cases, it can be permanent and life-altering. Infection. Even in the sterile, clean environment of an operating room, infections can occur either at the surgical site or internally. Mild infections are treatable with antibiotics, but more severe infections may require additional procedures or prolonged hospital stays. Surgical infections are typically monitored pretty close, but they certainly can lead to complications if they're not addressed promptly. Number three, organ damage. During an abdominal or thoracic surgery, there is a risk of unintentional damage to nearby organs. For instance, in gallbladder or appendix surgeries, the surrounding organs like the intestines or liver may be nicked with surgical instruments or scalpels. This type of injury may require immediate repair and further surgery. Number four, bleeding, hematomas. Surgical procedures always carry a risk of bleeding. While surgeons are trained to manage blood loss, internal bleeding, or the formation of a hematoma, which is a collection of blood, can occur after surgery. Sometimes this can require another surgical procedure to control the bleeding. Blood clots, number five. Post-surgery, patients are at increased risk of developing blood clots, particularly in the legs. These clots, known as deep vein thrombosis or DVT, can travel to the lungs and cause a pulmonary embolism, and that is a life-threatening condition. To prevent these developments of blood clots, many patients are given blood thinners or compression devices during recovery. And the last area that I want to talk about is adverse reactions to anesthesia. General anesthesia is usually safe, but there's rare cases where patients may have an adverse reaction. This can range from more minor things such as nausea and vomiting to more serious complications like respiratory distress or allergic reactions. So in conclusion, these are the 6 most common injuries that we see in surgical procedures, and hope you found this information to be helpful to you.